In MBBS exams, many students face the same frustration. You know the topic, you understand the concept, yet the marks you receive are far less than expected. The reason is simple. MBBS exams are not just about what you know, but how you write your answers. The most of the times, most students never learn how examiners distribute marks, what headings they expect, where diagrams are mandatory, and which keywords actually fetch marks. This exact problem is solved by intelligent assistant, that is MBBS Exam Guru. So what is this MBBS Exam Guru? This MBBS Exam Guru is an exam oriented intelligent assistant. It is designed specifically for Indian MBBS students and medical faculty. It thinks like an examiner because it is trained to think like an examiner. It has a clear purpose. It will help you write effective MBBS answers and maximize your marks. So let us see what this assistant is. First, you have to go to the web page. I will share the link of the web page in the description below. In the home screen, initially you have to log into that account. Don't worry, you have 5 free messages initially, and if at all you like it, then you can go for the subscription. And I will guarantee you, or I will even guarantee you will like it. So first in the interface, you will see there are some sample questions given. These are real MBBS style questions. You can click on that, or you can ask any questions. Like for example, you can ask LAQ, SAQ, BAQ. So just to give an example, I will write a question here as write a LAQ on shoulder joint for 10 marks, and I will click here. So it has started processing. So you can see here, it will think, it will get back to its knowledge, and it will write an answer. So as you can see, the answer is being written. So it may take a minute or so. And depending upon the particular topic, some topics answer might be very long. So sometimes it will give a half answer and it will stop. And if you think it's a half answer, you can click or you can type here. Here it has given full answer, so there is no problem. So let's see the answer. So the question was write a LAQ on shoulder joint for 10 marks. So if you provide such words, it will understand. You can write here for 10 marks or 12 marks or 15 marks. So it depends on which university you belongs to. So you can write 10, 12 or 15 marks. So write a LAQ on a particular question and for particular marks. Then it will start the answer. So first you will see the examiner tip. That means what an examiner expects for a particular question. So this will be different for different questions. So here, as you can see, this is for 10 marks. So it will suggest how many pages you should write roughly for that question, 3 to 4 pages. And it will suggest what is to be written. Like here, cover the type of the joint, articular surfaces, capsules, ligaments, relations, movements with muscles, stabilizing factors, blood and nerve supply, and applied anatomy. Also, it suggests a well-labeled diagram is mandatory for full mark. So this is an overview. Then it will give a star rating, means how much important it is and how commonly it is asked in the various universities. Then there is a mark split guide. So here again it has given for a particular LAQ what subtopics you should write and roughly how much marks is there for that subtopic. Like here, introduction and type of joint, 1 mark, second, third, fourth, fifth, sixth, seventh. So the marks are given. So how beautifully the table is given here. Then your actual model answer will start. So here in this case, it has given some bold keywords. So such keywords you should write in the exam so that you will get maximum marks, isn't it? Again, some tables are given for proper representation. So if you write such tables, such charts, the examiner will give you maximum marks. So in between, he will mention, or this assistant will mention the key points or keywords or score boost tip or draw a particular diagram. So such suggestions will be given. So like here. Then regarding capsule, then ligaments, then relations of the shoulder joint, clinical note, how, see how beautifully it is given. What is the most common? Movements with muscles, stabilizing factors, mnemonics. It will also give in between mnemonics or tips to remember. Blood supply, nerve supply, various bursaries with its significance, then applied anatomy. It has given, so which structure are at risk. This one, most commonly affected tendon, it has given, and the reason is also given, which test can be used. Then frozen shoulder, then this one, and it also mentioned which diagram you should draw, like this one. So draw a diagram including these things at least. Then high yield points you should remember are the mnemonics. So you should not forget this, like this: most mobile joint, most commonly dislocated, then mnemonic, this one, this one, this one, then the summary, and at the last, it will give score boost tip. Like to impress the examiner, you should always draw and label a neat diagram of this one, this one, this one, this one. So as you can see, very beautifully it has given the answer, and depending upon the question, it will give various tips, diagrams, mnemonics, etc. So this was about a particular question from anatomy. You can ask any question from physiology, biochemistry, pathology, pharmacology, or any subject right from first year to last year. So you will ask, what is the key benefits? So you can see here, for MBBS students, this assistant will help you write examiner oriented answers, and you will understand how marks are awarded for particular subtopics of a particular questions. Also, it will help you to improve answer structure. You can draw diagrams, tables, flowcharts, and also it will help you to revise efficiently before examinations. And this is also useful for medical faculty like teachers. Okay, how it is helpful? It is a standardized answer writing reference. It will act like a model answer guide for examiners. So these examiners will know how to provide the marks depending upon the answer given by the students. And also it will help the teacher guide their students how the answer should be written, what is expected. So what you should do, I invite you to use this assistant. 5 credits are free. You use it and you yourself decide. It will definitely help you remove your anxiety for the examinations, and it will help you to write answer in a structure way, and it will help you to get maximum answers. Thank you. Please check the link in the description below.